Hello and welcome to Infocus. I'm Bradley Valenaki. Thanks for your company. Disaster Ready and Wanto Counseling Helpline. Two services, of course, offered by Child Fund, an NGO in Papua New Guinea. And I'm privileged to have with me in the studio from that organization, Henry Gore and also Kinime Daniel. Welcome to the program. All right, so we'll first of all talk about the organization that you represent and the sort of work that you do. Just tell us a little bit about the work that you do.
Okay, Child Fund PNG is an NGO, non-government organization, works in Papua New Guinea, have a lot of projects that we implement: the health, education, disaster ready, gender-based violence and protection, and many other projects that are attached. Basically, our aim or goal that we want here at the studio is mainly to talk about disaster and Wanto Counseling Helping Line. And Wanto Counseling Helping Line has been established in Papua New Guinea since 2015. And also Disaster Ready program, which is also implemented by Australian. It's a non-government organization, Plan International, which Child Fund Australia is an implementing partner, and Care International, World Vision, and Caritas Australia, and other agencies network in disaster operations, and partner with 7 mainline churches in Papua New Guinea. So here we are. We just want to talk more about what we do in Papua New Guinea.
All right, so look, the organization you work for is Child Fund, but it's not limited. From what you're telling me, we're looking at disaster, also the helpline available. Look, this has come about because we do have a man-made disaster called violence against women within our country. The figures and from what you actually do in your line of work, what do the figures tell us of the situation at the moment?
The status for Wanto Counseling Helping Line since the inception of the project in 2015, we had reached over 50 to 60,000 calls who had been calling the helpline. So that shows that PNG is, we have a lot of women who face violence. So violence against women remains a big issue in the country. Across the lifetime of women, 1 in every 3 women face violence or subjected to physical or sexual violence by the intimate partner violence, and some of them also face from non-partner, meaning their other families or friends that they see as friends. So Wanto Counseling Helping Line has been established, and from that we have seen 75% spike in call during COVID pandemic, meaning that most of the services were not open at that time, so most women had faced violence. And as per our data, the status to pre-COVID was that we had an increase in 3,659 calls, which is 75% increase per quarter of the calls that we normally receive, like from 2,000 to 1,000 calls per quarter. So that was an increase in those times that we've seen.
All right. So Henry, from the data that that was put together, looking at the calls during the before COVID-19 and when COVID-19 had come into the country, what were some of the reasons why we had this kind of figures? Was it because there were women or more women and men at home, or what was the main cause of these calls?
Yeah, thank you, Bradley. After when COVID first hit around the year 2020, we saw a slight increase in the number of calls, mainly because when we went into lockdown, we had service providers going into lockdown as well, even hospitals, and people couldn't access those services. So with that challenge, the only person to come in contact was the Wanto Counseling, because it's free and it's accessible nationwide. So I think there was the push factor that made an increase in our calls in the COVID-19 period.
All right. I think it's important for our people to go back to the basics and understand why the One Talk Counseling Helpline was established. Why was it established, and what are the benefits of calling this line in times of help?
Okay, mainly because we have come to realize that violence against women is a real issue, and it's really affecting our country. So I would say it really started because we've seen that this is one issue where you may need to work against him, fix him, because we cannot say that was a nature blimol Papua New Guinean, but not also because money is superior over on Maria. But in actual fact, we are equal, and it has come to light nationwide in the global trend now. You see, over the years in other countries, like women have equal rights as men. So in our country, we've seen that this is a challenge. So I think that is the main reason why this One Talk Counseling has been created.
All right. So Henry, for our viewers out there, the One Talk Counseling Helpline, for them to reach out for help, what is it? How do they get in touch with you?
So if you want to reach us, our One Talk Counseling number is free of charge. It's 7150-8000 is the number. It's accessible nationwide. Whether you're in the village, you're in urban or rural area, you can access it. We also have I think it's just you have to have a digital valid SIM card to access our line, and our operational line is 24 hours. So call us, whether it's in the middle of the night, early in the morning. Our counselors are available 24 hours a day.
All right. So there you have it. If you have queries or would like to reach the One Talk Counseling Helpline, once again, it's 7150-8000. So there you can reach them for help. We'll take a short break now and come back on the other side with more. You're watching Infocus. Welcome back to the program. Now, our discussions still is One Talk Counseling and, of course, a disaster ready project from Child Fund, and my guest with me in the studio, Henry Goria, and also Kinime Daniel. Continuing on from our discussions now, more focused on disaster ready project. There's also one project that comes under Child Fund. Tell us about it.
The Disaster Ready is an initiative to strengthen local humanitarian capabilities and preparedness in the Pacific and Timor-Leste, so that communities are better able to respond to and recover from rapid and slow onset disasters. Disaster Ready will go into its second phase, commencing in July 2022, and will continue to work with communities and government, as this is a very vital service in the country. At the community level, Disaster Ready focuses on inclusive community-based disaster management plans to ensure that women, people with disabilities, and children are involved, in that all levels. Disaster Ready also aims at strengthening sub-national and national coordination communication mechanism and approaches a more inclusive humanitarian actions. This includes strengthening disaster preparedness and response capabilities in the province through the development of provincial disaster management plans and gender trainings and such, to ensure that disaster programs are up to date to assist whenever disaster hits the community.
So you may talk long this plan long lilik man meri o side watch tapa long island o land tablo mountain or lisa look him landslide na long nambis 2 time big plol win na sol waray kam na man sa go paula. You may talk long side long disaster. So one may talk long em now long this program child fund go pass long disaster ready also only work one them government now or line long disaster office come up one them all plan long how only can work in display legally call worker you also you talk finish me go down straight long all rural communities where all vulnerable population belong you mia also all line is stop on them disability all in hap long sawe na behind him too.
Yes. This SLAP program mainly to help people in the community wherever if they are stressed or having issues to getting that support where anything that causing like you said it very nicely, like the human disaster as well, or violence for that matter, or any disaster, not feeling stress, and then they can reach out to such services like Wanto Counseling Helping Line, where they can reach on their fingertips, like they have a phone readily available in such times of disaster and death. So this is what Child Fund has been doing in the communities, so also helping them to prepare for them when disaster hits and strikes, they would know what to do or how to get the service that is needed for them, or what are the things they could do in order to help themselves prepared for such things to come in the future.
All right, so this program starts a little later on this year and then continues. If Henry, you can add on to that what the actual program is about, and then how, like we said, will benefit the masses out there.
The main objective is to reach the people, the vulnerable people on the ground on community levels. So this program is more focused in areas where I would say they don't get much services. So like the unreached. So there's more focus in those that live around rural areas, I would say.
We're talking about disaster ready project, but this also works hand in hand with the Wanto Counseling Helpline, like you mentioned. There's a human disaster where we have created by not respecting one another in the community, and as a result causes abuse, and that's also one form of disaster as well, a man-made disaster that we've created. And for the natural disasters, the Wanto Counseling Helpline is available as well. So during disasters, there's people can also reach that line.
Yes, during disasters, Wanto Counseling Helping Line is like we said, is readily available. Anyone facing a disaster can call. Like it's not limited to women or men or children. Anyone who is facing disaster or facing violence, especially violence against women or children. And also for listeners out there, anyone witnessing can also call to seek assistance for whoever that is. And like Henry had put it well, that we operate 24 hours. The Wanto Counseling Helping Line operates 24 hours. And the type of service that we provide is counseling, crisis counseling, and referral options, providing referral options and referral support, meaning that when you call, you will be directed to the service that is really needed for you. Sometimes we get the challenge where people go to the services and they go to the wrong place at the wrong time. So this service, the telephone is you can call and know exactly what type of service and where the services are and who would be assisting you. Like in terms of disaster, who would you want to see? Where would you want to go? How would you want that support that is needed for you? So the helpline was privileged to be established in the country, and it has been doing this vital role for the past 7 years now.
Yeah. So when we're talking about, the helpline and the counseling that's been given, it's only for men or for women or men included as well?
I'll let Henry answer.
It's inclusive of everyone, whether it could be male, female, or as nowadays we go by like there's more. We cannot like more than I would say like transgenders. It's also we receive calls from them. So it isn't really limited to a certain type of gender. So we even have underage callers. Like we get calls from kids as young as 6 years old, or even older citizens who as ages like 70 to 80.
Okay. You talked about minors. If you don't mind me asking, what are some of the reasons why we have children calling?
That's a good question. So based on our database system, it shows that many of the calls from underage children is for reasons of child abuse, or when we have many callers that because underage children don't know how to put their issue, so they would ask for information on how what's this service about. Are you able to help me if I ask you? Because they don't really know. They feel they don't have this the capability of expressing, or they could be traumatized from what they have experienced. So we have trained counselors to actually try to tap into those, to make them have this confidence to speak up about what they're really calling about.
When a person is trying to reach for help using the Want to Counseling helpline, who do they trust, and who do they, there might be someone who doesn't have a phone and then goes to seek help from someone. From your advice, who do we trust in such situations?
Do not trust anyone. Service providers who provide service are more comfortable. They are neutral and they do unbiased decisions, and they provide support such as Want to Counseling helpline. If you do not trust your friend or family, you can call Want to Counseling helpline. And the other thing that we've seen our data, witness, they provide that support close, like Henry had said. Anyone that you trust could not abuse you with the information that you shared with.
All right. So, good discussions. Before we go long break, remind again long who side you long watching this program na you pili mo sem one pla where me stop close to long you, isawe make him no good long you, isawe abusing you long talk or some way where all use him long fight him you or make him sample something long skin long you, please. Once again, reach him display helpline, long kiss him, halve him. You're watching Infocus. We'll take a break now and continue with more on the other side. You're watching Infocus. Welcome back. Our discussions, very interesting ones from the Want to Counseling helpline. Now we'll tell some stories of success stories of those that have come forward requesting for assistance and have made it to the other side happy. So let's first of all hear it from Kinime, some of the stories that have come out positively.
We had a lot of experiences saving a lot of women, children, young men, and even men who went through violence, on how they could help to build their relationship in a marriage. And this helpline has been a very vital way of assisting. We had a lot of experience. There was one experience that we had in Brigo province, district in Central Province, where a caller had to climb the tree to call for help. And this was not related to gender-based violence, but it was related to a woman who is pregnant, and she wanted to seek the assistance, and there is no hospital, there is no road links, and the only communication that guy could get was to climb up a tree and call us. So when we had that call, we had to navigate on the assistance and call the hospital, and also call the air agencies to provide that aid was needed. And because the baby was sleeping across, and delivery time was over, and she was about to lose her life with the baby. And that was a very successful story that we had to. Now she's with her child, And she had called us and thanked us for that support that we have given her.
I think because of the fact that the helpline was free at that time, so he could just make the call and then everything else was history.
Yes, and even the nurses went in, and it's not that they brought in the child, but they have to go into the village with the medical aid to provide that support that is needed, airlifted there. So that was a very good achievement for us. The other achievement that we had, there's so many stories to tell, but just I'm giving two stories. One is a woman with a baby at the police station. She couldn't get the help that is needed at the police station. Even the police officers, because it was late in the night, there was no one to attend to her. So she saw the number, 71508,000.
It's usually on the police stations outside. Yeah.
So she called in one of the police stations in the cities. And so we had to, our operation, 24-hour operations, had to call and then call back the police or check other numbers, sources, and then got Black Swan. And then we have to navigate and call different people to ensure that we get to the police station. And until we get to that police station again, and the officer went there, and we made arrangement for the safe house, and she was saved with her baby at the safe house. She had been violated by the husband, and she had to run into the street for safety. And the only place that she could be saved was the police station. And she was saved, but she needed a shelter to be there with the baby.
Of course, in the middle of the night, it's not safe for any woman and child to stand out in the open.
Yes, so that were the two success stories. But there are many, many from sorcery accusation and many more. And to the viewers out there, there are so many women who had called us and said that I am being lucky, I had been saved because of this helpline. If I had known this helpline, I would have been saved. So one call can save a life. So anyone, our families, friends who are facing sexual violence or physical violence or any form of violence or stress or even suicide, we have helped a lot of suicide cases. So for that matter, please, this is a service that is provided in the country and which is really free. And I think in other countries, they've got 911. And here in PNG, we should treat this number as a 911 call when we are in gender-based violence or situation because it's operating 24 hours a day.
All right. Something for us to think about seriously in this time. Don't forget the number again to get in touch to is 71508000. That's 71508000 again showing on your screen now. Continuing on with the positive stories that we are telling now. Many people will feel that during these times when they are calling, help will not come, but that's not the case. Many times we've helped people, but Child Fund is not alone in this, like you said. Tell us about the partners that the organization, the NGO, is working with.
Thank you. That's a very critical part of our work is to build and strengthen the referral pathways. And Child Fund has been also focal in building and strengthening pathways for survivors to access. And the partners that we work with, CIMC, FSVAC, NCDC, FSVAC, and all the GBV frontline workers, and also disaster frontline workers who are working. And we are glad to have this program funded. It's been funded by New Zealand and Foreign Affairs and Trade. But we're also looking at sustaining how best it can be sustained in Papua New Guinea, such vital service that has worked. And we've linked with more than 350 service providers across Papua New Guinea because the helpline is it's a national toll-free line covering 22 provinces in Papua New Guinea. So we've also built and established network with all the service providers across the country. And we do have a service provider directory that we share with partners so that they know who's working in that line and they can provide that assistance that is needed.
All right. So also in areas where it's unreachable, you in districts throughout Papua New Guinea, there are people like human rights activists who are available, and they are representatives of the goodwill, the good work, and they also assist in this regard as well.
Yes, of course. When I said service providers, they are all included, the good human rights defenders, the good pastors, and the volunteers. They have been very vocal, and they had been there for the people in the community.
All right. So before we end, a final one from you, Henry. Final words.
Okay, viewers out there, please, if you are facing violence or any forms of abuse, our toll-free number is available 24 hours and 7 days a week. Please feel free to call. If ever you witness something, any form of abuse or violence, please just call us. You never know. You could be the missing link to help somebody or help yourself.
Right. Very vital words there from Henry. Once again, I would like to thank my guests in the studio from Child Fund, Kinime Daniel and also Henry Goria. Thank you very much for joining us on the program.
Thank you, Bradley.
All right, this has been In Focus. Again, the toll-free number now showing on your screen. If you would like to get in touch with us, you can email us on the email now showing on your screen. You can engage with us social as well on our social media pages. If you missed this program, you can catch it a little later on YouTube. From all of us here, stay safe. Don't forget, again, the helpline now showing on your screen. Do get in touch with them in your time of need. From us here, stay safe. Bye-bye.